Hip fractures are common injuries amongst the elderly, with around 2,700 cases in Singapore each year. Because hip fractures are painful and can lead to further complications, it is important to treat patients with hip fractures in a timely manner. This video explains what hip fractures are to help you understand the condition better. Hip fractures occur at the upper thigh bone or femur, which is connected to the pelvis at the hip joint. There are two main types of hip fractures. The first type is the neck of femur or NOF fracture, which is located closer to the hip joint. The second is an intertrochentric or IT fracture, which is located further from the hip joint. Hip fractures often occur after a fall. In the elderly, even minor falls are enough to cause them, while younger patients usually sustain them after a high-impact accident. Having lower bone mass increases the risk of hip fractures. Factors that contribute to low bone mass include being over 60 years old, being female, or having conditions such as osteoporosis. Every hip fracture injury is different. The treatment that patients receive depend on many factors, including the patient's current health condition and the nature of their fracture. When the patient arrives at the emergency department, our doctors will take a history, perform a physical examination, and order X-rays to derive the diagnosis. Sometimes, advanced imaging such as MRI scans must be done if the diagnosis is unclear. Most elderly patients with hip fractures are fit for surgery, and timely surgical intervention is usually the best option for pain control and recovery. However, those who are less healthy may need further treatment before proceeding with surgery. The surgical procedure will depend on the type of fracture sustained. Surgery for intertrochanteric fractures aim to fix the bone back into its original position. The surgeon holds the bone fragments in place by securing them with metal implants. They can be placed within the bone or on the surface of the bone. For neck or femur fractures, we will perform either a partial hip replacement, which replaces only the ball joint at the end of the femur, or a total hip replacement, which replaces both the ball joint and the socket on the pelvis. In the rare circumstance, we may choose to fix the neck or femur fracture instead. Like all types of surgery, there are certain anesthetic and surgical risks. It's important that you know what they are. Surgery is recommended for most cases. Non-surgical options are recommended only for certain patients, such as those too unwell to have surgery. Our surgeons will provide advice for patients who opt not to go for surgery, as there are also risks for conservative management. After surgery, it is important to help patients regain movement as soon as possible. This reduces the risk of other medical complications and improves long-term recovery. Most patients can get out of bed and begin therapy the day after surgery. Our physiotherapists and occupational therapists will teach the patients simple exercises and how to manage daily activities. The exercises are essential for recovery and must be done diligently. We will provide adequate painkillers to ensure that the patient remains as comfortable as possible after surgery and for them to feel confident to participate actively in rehabilitation exercises. Patients are usually discharged after 3 to 5 days. We highly encourage patients to recover at their own home. If this is not possible, your care team will assess other post-discharge options. Your therapist will also prescribe some exercises for you to do at home. It is important to come back for follow-up appointments and therapy sessions to ensure a smooth recovery. About half of the patients can expect to recover to their pre-injury state in about 3 to 6 months. However, for many patients, their physical functioning will be slightly affected even after recovery. Many patients may still require walking aids even after full recovery. It is important to focus on the immediate management of the patient's hip fracture. But simple lifestyle changes will reduce the risk of future fractures once the patient has recovered. This includes keeping a healthy weight and consuming foods rich in calcium and vitamin D, engaging in a regular exercise routine to maintain muscle strength and balance, as well as investigating and seeking treatment for pre-existing osteoporosis. While it is important to treat hip fractures in a timely manner, every injury is different. Our care team will consult every patient and their family based on the patient's specific condition and the best available options. Our orthopaedic team will be available to clarify any queries and discuss further management for you or your loved one.